I see, and I'll just focus on the pediatric side of the problem. I have no financial disclosures to make. As has been discussed before, it is a Pandora's box simply because of the different kinds of issues that make up the orbit. The disorders can be cosmetically disfiguring or vision threatening or even life threatening. What you need is a methodical evaluation to analyze each of these cases, and that would help you to arrive at the correct diagnosis and then the correct management. So what the goals of evaluation basically do is help you answer these three questions. What is the disease? If you come to know what is the disease, is it life-threatening or sight-threatening? And then of course, how shall I manage the problem? So the symptoms and signs of orbital disease basically stem from the issues that are involved. Eye position is changed because of displacement, or if it's an excitation, then it's because of it leads to proptosis. Visual disturbances because of either compression or direct involvement of the optic nerve, pain because of the involvement of the sensory nerves, or sometimes infiltration of tumor into the sensory nerves. Bodily disturbance and diplopia result from involvement of the extraocular muscles. Inflammation would lead to swelling, redness, giddiness, and pain. And sometimes you can even come across the mass lesion, you can palpate it, and that helps you to come to a diagnosis. So if you just cover these 6 points, onset would mean at what age does it present? Is it presents first or does it develop at a later age? Whether it is acute in presentation, the duration would be whether it is less than 7 days, is it between 7 days to a month, which would be a subacute presentation, is it present for months or present for years? Course would mean whether it is progressing, is it resolving, is it static or is it intermittent? And you could arrive at a differential diagnosis by noting whether the disease is present on one side or both sides. Dr. Usha and Dr. Senthil have covered this very nicely about knowing where a lesion is depending on the direction of displacement, and you try to arrive at an etiological diagnosis. We cover that a little bit. So this helps is covered by history and clinical examinations, and that takes into the differential diagnosis or sometimes even have a spot diagnosis. When you do it, then you go for imaging, and that helps you to refine your diagnosis and narrow down your differential diagnosis. Sometimes you can intervene surgically at that very stage, or you do a biopsy, which gives you the final diagnosis. With biopsy, you could either be an excision biopsy, where you remove the tumor in entirety, or to know the nature of the disease, you do an incisional biopsy. So, the etiological diagnosis, you try to slot your patient according to this. Is it an inflammatory condition? Is it a structural problem? Is it a vascular disease? Is it traumatic or is it neoplastic? If it's neoplastic, whether it is benign or is it malignant? And you do a very thorough examination that would include regional examination of the face and perioperative region, comprehensive ocular examination, systemic examination, as well as several physical examinations regarding pulse, CBP, etc. So the pediatric orbital diseases that we have encounter are either benign or they're malignant. Benign could be inflammatory or structural or tumors and vascular disorders. And the malignant, the common malignant conditions you would encounter are the rhabdomyosarcoma, PV sarcoma, PMET, leukemias, orbital retinoblastoma, or metastatic neuroblastoma. And we'll take a look at how they look. Okay, this is a child who is 6 years old, presents with this very warm swelling in the upper lid region. The lids are very tight, and eye movements are restricted. Pupil shows are irregular. This child has actually been treated with oral antibiotics for 5 days before he was sent across to us. As you can see, it's a unilateral disease. What do you think is etiology? It's very, very clear. It's inflammatory. Now, he had fluctuation in this area. So what we did is we took him as an emergency and drained the orbital abscess while we had instituted him on intravenous antibiotics. A day later, we saw there was significant improvement, and we started him also on systemic steroids. So this is what it was. There's another patient, again a 6-year-old child. This child presented with acute conjunctivitis in both eyes. It was purulent conjunctivitis, and the swelling just increasing when he was admitted to a hospital. This is just 3 days old. It seems like a bilateral disease, but if you examine his eye movement, you find that his eye movements are restricted on the left side. So, is this again an orbital cellulitis? We did a CT scan, and what we found is that there was significant swelling in the lacrimal gland on the left side with indentation of the globe. And this child had suppurative acute bacterioiditis and again responded very well to systemic antibiotics as well as steroids given later. Okay, another child, this is a 4-year-old child complaining of double vision. There was a little bit of congestion on the superior rectus muscle area insertion and soft swelling of the lids. There was restricted eye movements, vision was normal. As you can see, it's a unilateral disease. Again seems to be inflammatory, and this is what the ultrasound scan showed, that there was a cystic lesion in the superior rectus LPS complex muscle with a central high reflective body, probably a scolex, and this child responded very well to treatment for cystic surfaces. Another patient, she's an older girl, she's 15 years old, 3 weeks history of gradual pain in the orbit, and then she starts complaining of diminishing vision in the left eye. And all that we have is a mild proptosis, and she has limitation of abduction in the left eye with diplopia while looking towards the left side. And this is what a CT showed. She had a thickened swelling of the lateral rectus muscle along with the scolex towards the apex. Vision recovered very rapidly once the therapy was instituted. These are spotted diagnosis, lateral angular dermoid, and this is internal angular dermoid. Usually these tumors arise from suture lines, and you have to check for fixity with the overlying skin as well as the bone. If you find that there's fixity to the bone, it's a good idea to do a scan because there might be an intravenous component that you have to tackle. This is an obvious diagnosis. This child, from the skin itself, you know that this child has capillary hemangioma, which also has an orbital component. This child did very well with intradistal steroids. The new upcoming treatment now is oral propranolol, which is given as 2 mg per kg body weight per day, best under the care of a pediatrician or a pediatric cardiologist. Okay, we have, this is not a child, but there's a reason why this patient is here. His doctor noticed that he had proptosis on the right side when he went for a refraction and sent across to us with a CT scan. What he had was a palpable swelling in this area, with except proptosis, but a little bit of downward and inward displacement. And he was married for 3 years and his wife never noticed this. Okay. So, with this clinical examination, what we actually thought was a probable tumor in the salivary gland. And this is what does this, the lacrimal gland, and this is what the CT scan shows. Okay, he had a cystic mass in the orbit with a large intraosseous component. This was a deep orbital dermoid. Another patient, 15 years old, was playing football with his friend when he got knocked on the eye. And over the next 3 days, his eye progressively became swollen. The lids apparently had kababata, and he went to an ophthalmologist and he was given systemic steroids, and his swelling began to reduce. But it continued to persist for a month. And that is when he was referred across. He had normal vision, there was no RBG, but his eye movements were only mildly restricted with diplopia on the extremes of gaze. His funnel of a short choroidal folds inferior to the disc. And this is what the CT scans show. These are the scans that he had with this. An interconal mass encompasses the optic nerve. The problem was that this was an acute presentation, 3 days. And whenever I see anything surrounding the optic nerve, I really get nervous because you want to know whether the disease involves the optic nerve or not. So we got MRIs done, and what you find is a very cystic lesion surrounding the optic nerve. The high cystins are because of the presence of blood within the lesion. And these fluid levels that you see on the X-ray scan reveal the nature of the disease. This is a lymphangioma which had a bleed within it. And this patient just underwent orbital aspiration and swelling had subsided. Okay, another patient, this child is 7 years old. He presented with gradual proptosis over 2 years with diminution of vision. He has 624 vision in his right eye with RAPD and elevation effect. He also shows optic disc pallor. It's a unilateral disease, and this is what his visual field is on the right side. The left eye visual field is absolutely normal. What do you think this child would have? unilateral axial proptosis with vision losses in the child. So this is what a scan showed. He's got a fusiform mass with a kink in the front. And as you can see that the mass involves the optic nerve, but the penineural sheaths are normal, and this is a classic example of an optic nerve glioma. Another child, this child is also 6 years old, and he fell down in school a month ago. But 2 weeks ago, his eye started swelling up, and there is a very palpable swelling here, which is very firm. The eyeball has been pushed up, and as you can see, the lesion is inferior to the globe. What this scan shows is very interesting. He's got a destructive lesion, a bone destructive lesion, which is arising from the zygoma, but it is not involving the sinuses. And we did an incision biopsy for this child, and turned out to be Burkitt's lymphoma. Another girl, she's again 15 years old. She was supposed to appear in her class 10 exams this year, but presented with a very rapidly growing swelling over a period of a month with non-axial proptosis, very firm mass lesion here, and this is what the CT scans show. A very well circumscribed lesion in the lateral part of the orbit, extending posteriorly, but there is no bone involvement. So we did an incision biopsy here again, and it turned out to be a rhabdomyosarcoma. The last 2 cases that we have. This is a child presented with rapidly increasing puffiness of the eyelids with a little bit of redness, and the history is 4 days old. And when he was referred to us, we found that he had puffiness on both sides, and you can see the congestion here. He actually has a subcon hemorrhage here with mild chemosis in this area. And if you notice carefully, he also has a subconjunctival hemorrhage in this eye. So what would be your likely diagnosis? It's a bilateral disease. The proptosis is more on the left side, and on palpation we found that this fullness was because there was a soft tissue mass in that area, firm in field. A complete eye examination is also being a fundus examination, and this is what we found while we were sending him to the scan department to find out what it was, and this itself changed the way we managed this patient. So instead of going for the scans first, we went to the lab to give his blood samples. This is what the scan showed once they came in. So he's got large lesions in the superior orbit with necrotic areas, and the peripheral blood smear confirmed that he had acute myeloid leukemia. So that's a diagnosis that you get within 2 hours of the patient coming in. This is our last patient. It's a 1.5-year-old girl presented with rapidly increasing swelling in the left eye, and what is very prominent is the echinosis that she has in the periorbital tissues, along with fullness of the temporal fossa. And this is a scan which shows that there is a mass lesion involving this area, which is the junction of the orbit, the temporal fossa, as well as the middle cranial fossa, and it's a favorite for metastatic lesions. She also has this swelling here, which is more on the left side. On examination, there was a large abdominal swelling, very firm. This is what a CT scan shows. It's a huge mass which is displacing the liver, and an FMC was done from the liver. From this is from the abdomen, and it turned out to be metastatic neuroblastoma. So this periorbital hemorrhage is very classical for neuroblastomas. To summarize, children have a spectrum of diseases which are very unique to them. If you're just aware of the conditions, it is easy to make a rapid diagnosis. We need to understand which are the cases which need emergency evaluation and management. And if you do a systemic evaluation and a proper investigation, you will always arrive at the right management. Thank you. I request Dr.